guys, welcome back to my channel. I'm Renata, new nurse practitioner, the Black NP. So today I wanted to go ahead and get into, y'all, I had my first day of not real work. It was more like a conference, but it was fun anyway. And I got to meet some of the people that I'll be working with and some of the nurse practitioners and doctors that I'll be shadowing. So let's just hope they're as friendly as they seem, because it was a very good day today. It was very nice meeting them all. So without further ado, I meant to come back and tell you guys what I'll be using as a new grad nurse practitioner starting out. My little books and the little SUTURING kit that I mentioned. I'm gonna practice on that, and then I'm also gonna show you guys what apps that I think are gonna be beneficial that I used while I was rotating through urgent care, and then just little other things that I'll find beneficial in my practice. Like I made a binder. So in this binder, I had class, of course, when I was rotating through school, and the teachers, of course, would give us worksheets and handouts and things like that we could use during those rotations. If you have those, save those, because they come in handy later. And they're usually updated with the most recent guidelines, and so you can use them in your practice. When you get out of school, you don't have to go and find them all and look it up and all that stuff. So with that, that's how I basically started my new nurse practitioner binder, so to speak. I watched a couple of other people on YouTube, and they were basically saying the same thing, that they have a binder, but a lot of them made it themselves or bought it from people online and things like that. But I just used, of course, guidelines and things like that from JCO and stuff like that. I have those printed in my binder because they usually have them posted in the office, but I like to have my own copies of stuff so that I can jot things down that I might need to know later, or for a certain patient, if something occurred, then I had to do this and it could work for another patient, so I would jot something down like that just for my memory. So yeah, without further ado, let's get into those. First things first, like I mentioned in my prior video, if you guys haven't watched, go back and watch my videos. I kind of go lead up to things in my videos, so they kind of play off of each other. I don't know if I'll continue to do that, but we'll see. It's just me figuring things out because I like it. But anyway, so like I mentioned, get you a little clipboard, preferably with some paper in it, so that you can use that to take a couple of notes throughout your day, throughout your shift, that you might want to jot things down because you want to look it up later, or a patient came in that you might want to follow up on. So have this, you can write that patient down, you can follow up with that patient later. I'm in urgent care, so that's more of a primary care provider type thing, but because I'm in urgent care and I'm new, I do feel like I want to follow up with some of my patients, and I'm in more so a medical group type of workspace, and so my patients will be patients I can follow up with, and I'll be working in primary care too, so I'll let you guys know more about that within my practice. And so yeah, so I'll be able to follow up with some of the patients. What I'll be using to write is my ink pen from Tiffany & Co. that my husband got me for graduating nurse practitioner school. My favorite ink pen of all times. Hopefully no one ever steals it or I lose it. I love Tiffany. Also, I'll be using this one because I like different colors. And because they usually come, the big pens usually come with the blue at the bottom. I got the pink one. Simply because pink is not my favorite color, red is, but simply because this one's easy to decipher, and it's kind of cute to decipher if somebody were to steal it, because don't steal from me. So yeah, those are those. This will be the book that I'll be utilizing. I used it in my rotations, and I made notes throughout and things like that, and I have little pages clipped off that I like, that I know are common issues people come into urgent care with. I'm, like I said, an ICU trained nurse, And for nurse practitioner, most of my rotations I did through the urgent care, unless it was specific that I needed to be in primary care, or even when I was in pediatric rotation, I did half in like a pediatric clinic, and then I did half in the urgent care clinic where I would see children in the urgent care. So with that too, one of the doctors that I was sitting by, he was like, "Oh, you're a new grad and you're going into urgent care?" He's like, "That's gonna be hectic." I was like, "Well, most of my training was in urgent care and I'm an ICU nurse." He was like, "Stop right there, you'll be fine." So I will say your background plays a major role in where you can go, but don't limit yourself. If you were in med-surg tele or just med-surg, you want to go into urgent care, there will be a steep learning curve, but never let somebody tell you what you cannot do. Yes, you can. All right, on to this. Sorry. So yes, this is the practice guidelines for family nurse practitioners. I got it off Amazon. I'll link it down below in my description box. This was a really good book, or is a really good book, and this is the most recent updated version of it. Really cannot remember how much it costs y'all when stuff. I don't care what it costs, I'm gonna buy it. Make the money, buy it. So that's my philosophy. So it's by Karen and Barbara Hudson. So yeah, get this book. It just goes through literally the beginning of it gives you laboratory diagnostics, like even the assessments that you would need to do for certain people, age groups and categories. And then what I've been doing, because we do see a lot of dermatological issues and you don't want to refer them all out unless you just absolutely have to, especially in urgent care. You can treat things. You can, order mupirocin and Bactroban, which is Bactroban, and things like that to treat certain skin infections like impetigo, right? So I would order that for my patients. They give an extensive treatment plan as well. Like it goes through your diagnosis, your assessment, your plan, when you should follow up, when you should refer out, like everything. And it's by systems, and then it also gives you by like type of disease. So if I wanted to look up GERD specifically, of course it's in the GI, so I'll go to GI, then go to GERD, and then it gives me like how I would assess for it. You do a system above, a system below, and try to rule out things to help it rule in. So it goes through all the diagnostics that it could be, and of course if it goes and it's not GERD, then you have your preliminary other diagnostics that you can work up through. So as a new grad, I feel like this is going to be very, very helpful. I would recommend getting it if you're going, or when you start rotating through your clinicals. Okay, so next thing, well, I kind of discussed my binder, but I didn't show it. So this is my binder. But yeah, so then this is just like a well child, and like the most common urgent care visit reasons. I made just a list and looked up like the commonalities of what they are. And then this would be like the pediatric history exam, and I made tabs. I haven't written on them yet because it's like a work in progress, but made tabs for different things that I wanted to have in my binder. Like this is dermatology again, describing rashes and lesions, because yeah, we know like what we went over in school. You want to go the length, a description of what it looks like. You're going to take a picture if it's any color. Of course you want to rule out cancer, right, with your A, B, C, D, E and things like that. And so yeah, I just wanted to have just something I can refer back to without having to like literally go look up everything on my phone. I can just flip to it real quick in here. So then this would be like insulin therapy, the step-by-step, what do you do next, or when do you go to insulin therapy, things like that. So whatever you need, put it in a binder, like print those papers out. I actually went to, was it Staples? I think it was Staples, because I think our Office Max closed. But yeah, I think I went to Staples and I just had everything on my little flash drive, took it to their printer, and literally just printed everything that I wanted, that I had on there, that from school or guidelines that I had looked up, and I just put them in here. That's it. I bought a hole puncher, put them in here. And so yeah, so that's my other thing. Whatever you feel like you're gonna need, what you're gonna be comfortable with, and what's going to help you, because you've been through, or you've been rotating through, right? And so when you're in class or when you're in the clinical setting, you know exactly what you're using and what you're needing to look up all the time. So print those things out and you can refer to them a little easier if you have them in your binder. There will be times when you have things that you don't know or haven't seen and things like that. And there will be times when you just forget stuff or things change, or you want to give your patient some information about a disease process that they're newly diagnosed with and you want the most recent information. You can print some from like the CDC's website, or my favorite thing, you could go to UpToDate. So UpToDate, I have this app on my iPad. I just went to Google and like literally pulled up the big picture of the app. So UpToDate is a place where a lot of clinicians use. They go to look up diagnoses, like treatment plans, the latest, because it's up to date, right? So it's the latest information for treating diseases and disease processes. And it also gives you like a patient education tab. It does come at a cost. If you're a student, it's a little cheaper. I don't remember the pricing for it, but if you're a provider, you get a discount as well. So I'm using this for a CEU because when you're looking up things, it's gonna literally, it keeps track of the number, like the hours that you're using, because if you scroll through the document, it should take you this amount of time to like look through it and things like that. And so every time I'm referencing and I'm looking up things and I'm reading through it, it's counting those for CEUs for me. So yeah, so use that. And while I was pointing out the UpToDate app, this is also a tool that I'll have with me, just because I don't want to. I have my phone too, and I do have the app on there as well, but I would like to look up things and see it bigger here. And I can also, if I ever leave my notepad at home, I can go to notes here, use my Apple Pencil, and write on my iPad. So I'll be having my iPad with me in the clinical setting. There's also books that I have on here that I'll use. One specific book I'll show you guys is for differential diagnoses. Okay, yes, so this is the book, the Robert H. Sellers Differential Diagnostics of Common Complaints. This is the book that I have a PDF version of, and I use this so much, like throughout my program, through every class that I took. This was my favorite book. This one and the Cash and Glass. I cannot remember the name, but it was a red book. It's also a PDF version of it. But this is the one that I would recommend to you guys, that I utilized a lot, because you can go to table of contents, and then if I wanted to say, oh, my patient has abdominal pain, it's a PDF, right? So I can click abdominal pain. It'll go and it explains like different types of abdominal pain, and then and then it tells you where you should like palpate. You'll feel the patient has pain here and there, things like that. And the associated symptoms, your physical findings, diagnostic studies that you'll use. And then this table is very small, but of course I can zoom in on it and be able to read it or whatever. You could do that and or use your book, the practice guidelines, to develop like your treatment plan and things like that for how you're going to follow up with this patient. So yeah, so next up, I explained that I stated that we would do some suturing. So I'm just going to go ahead and do a running stitch on camera. I haven't used this yet, guys, so you guys will see me in my mess ups and everything, and I'm very excited because I'll be learning how to do this on the job. My practice told me, they'll be teaching me how to do injections for knees and shoulders, maybe some hips. I'll also learn how to suture for minor lacerations and things that we will see in urgent care. I'll get to use bracing for when people come in with fractures and like of the ankles, the wrists, and arm, elbows, things like that. I can help get them casted and things like that. We also have in-house orthopedic that I could just send them down the hall to, so that's perfect. But for minor things like a sprain or something like that, especially, like, I can wrap that up and you can go on about your day. So yeah, I'm gonna go ahead and set that up This all came in this kit. I'm not affiliated, but it was one of the ones that I saw on Amazon and it had good reviews, so I purchased it. It basically comes with everything you see here. I don't want to have to explain all of that. Hopefully you guys can see it, but also it'll be linked down below. So yeah, I'm gonna go ahead and get that set up for you guys to see. That's all that I had to show you guys as far as references, materials that I'll be using throughout my start as a new NP, and I'm pretty sure I'll continue to use those throughout my career. So yeah, I'm gonna go ahead and get set up and I'll be back to show you guys. Just we'll do a running stitch and then we'll do an interrupted. Haven't looked those up just yet, but yeah, we'll practice together and see what happens. Okay, so this is in the kit and it literally says for training purposes only. So don't go trying to like suture somebody up with these. And then I'll be using this 19mm by 3/8 non-absorbable suture for training purposes only. And of course, when you're actually doing this in the clinical or hospital setting, wherever you are, you would have on some sterile gloves and all that jazz when you're getting ready to do this. So this is how it comes. This is your thread inside, your needle there, and then I like the curve. So you're gonna take it, you keep it in here. Actually, you don't open it, but I did, so it kind of fell out when I was showing you guys. But yeah, so you take it in here and you can lock it. Get something in practice with it before you go in to practice doing it. Oh yeah, so we're gonna do this one with a continuous stitch. So if you're not gonna clamp it with that, you just make sure you hold it, right? So then you're gonna come in, you wanna start toward the end. You wanna, what my preceptor said, grab some meat. So you're gonna go in, drive it through, and you should be able to see it right here. And I'm already articulating with the other side, so I'm gonna go ahead and push it through here. And this is why we numb our patients, right? Because nobody wants to be not numbed and getting this procedure done. So this one actually was a little tangled, so it had a little knot at the end, but I'm gonna leave it like that, and then I can put more of a knot at the end of it once I'm done. Then with my sterile gloves, I'm able to grab it, reset, do it again. So and with your second one, okay, y'all, I'm back again because I started on that last one with y'all and I was like, wait, I don't remember nothing. I did this all wrong. So I went off camera, watched the video on the website that provided this kit and looked at the simple running suture, sorry. And I was like, okay, let me practice. So I sutured this laceration all the way up because I want to go from the beginning again and show you guys how to do the knot at the end. So before I give up, let me just try this other set too, because maybe I won't do an interrupted, because child, I'm telling y'all my wrist hurt. Okay, so yeah, no, I can tell I don't like this already. I gotta bend my wrist too far back to get it into the skin for me. But I feel like it dries a little better. Let's see. Let's continue before I come up to my conclusion. Okay, let's try 3. So 1, 2, 3. Reminded me of the little owl. Where he was like, how many licks it take to get to the center of a Tootsie Pop? I know y'all know that commercial. Okay. I don't know why my little sutures are like, no. Okay. Oh, I forgot to wrap it the other way, so let's do it this time. Okay, there we go. Whew, these little sutures give me a run for my money. Again, you go to the end here, right? You're gonna hold it at the end. Almost done, just that little end tip piece right there. So at the end, just like you did at the beginning, you're gonna go in and then you want to leave like we did at the beginning. I was supposed to cut that again, I forgot, but you can always go back and cut it when you're done. Cut it close to the knot but not at the knot, so that you have a little piece there. So yeah, you want to have this piece out here, and again I always start to the right because I'm gonna remember to go left next, you know. And I'm gonna do 3, and then I'm gonna hold this end because now we don't have it like we had this piece. It was our beginning. We're not at the end of our thread, and even if we were, it would still have to form a loop. So we need that loop, and then we're gonna slide it down and have it go down, and that's the end, just like we did on this side. Now we have it on that side, but we had to use a loop because we didn't have a ending on it. So again, I went right first. I'm always gonna remember I went right first, so now I go left. Okay, and I hold that loop, bring it through, tie it, and then I go right one more time, and bam, we are done. I made it, y'all. Ooh, that was a struggle. So then you hold up your 3 pieces, right? Because I count this one side, 2 sides, and you can say, I mean 3, and you can say 2 pieces if you want to, however you want to. So I'm just gonna make sure that's tied. Just make sure that it's just touching and they're lined up. hold this up here, cut it off there, and that's it. So I think I'll go ahead, y'all, I'm tired of this, but I'll go ahead and show you or practice, because I'm not really teaching, because baby, I still got practice to do. But we can do an interrupted. So basically the interrupted suture will be you doing it, you start it out, you make your knot and you cut it. Then you go to the next one, you start it, make your knot, cut it, and you keep going. So instead of it being continued through, you have knots all the way down. Okay, so we're back. And y'all, that was a struggle for your girl. I'm gonna have to be like focused when I go into my little class when they teach me how to suture. Yeah, that was a lot of fun though. I plan to practice some more and hopefully learn some more. And when they're training me, I'll come back and show you guys my new suture techniques and we'll see how much I've improved. I think that's all I wanted to tell you guys. Like I said in my past videos, let me know if there's something you guys want to know. If you want to ask anything, any questions, you want to like have me make a video about something, let me know. I'm open. I'll be making my next video. I just want to like give my little tidbits on routes that you can take to become a nurse, because everybody's route is not the same and it's different ways to get here. You do not have to go like straight into college and get a BSN degree in nursing, and that's the only way that you can be a nurse or a nurse practitioner. Like there's so many different routes you can take. So I think I'm gonna make a video just discussing ways to get into this field because it's very lucrative. It's you don't have to just go into bedside nursing in the beginning. Like you can go work in a clinical office, you can do case management. There's so many roles and things you can do in nursing. So yeah, that I'll discuss in another video, maybe in my next video. I haven't decided yet, but I know my next video, like my literal next video, is gonna be me starting work, my first day, and I'm so excited. I'm showing y'all my little outfit, and we're going to take some professional photos because your girl's a professional. I need to get it popping because I got businesses I'm about to start. Okay, that's another thing. As a nurse or as a nurse practitioner, like get to the shmoney. So I'm gonna start. I got a few ideas for some businesses I want to start. So yeah, you guys gonna go on that journey with me too. We'll reconvene when I get my thoughts together and have it all together. But yeah, so looking forward to everything that's to come. I'm so blessed, guys. I could cry right now because I'm so excited for what God is doing in my family life, in my life. And He's never forsaken me. He's never left me. So I know He won't now. You know what I'm saying? So yeah, I don't think I have anything else. I feel like I'm rabbit holing and tunneling. So I'll let you guys go. Thank you so much for watching. Let me know if there's anything, you want me to do. And thanks for your time. I really appreciate it.